we're working to protect as many beats as possible. We need to look closer to see a better way. Current methods do not adequately personalize risk, and treatment is focused on care after symptoms emerge or a heart attack has occurred. At Clearly, we've spent more than a decade performing some of the largest clinical trials to identify the most important indicators beyond symptoms that increase a person's risk of heart attack. What we've discovered has led to innovation, a promising way to identify heart attacks before they happen. Our AI-powered technology analyzes detailed images of the heart to deliver comprehensive and trackable insights about the presence, type, and amount of plaque in the heart. All this adds up to a greater understanding of your heart disease risk and likelihood of a future cardiac event, empowering physicians to create a personalized care pathway that will transform their patients' heart health.
Hear in their own words why they should win.
Well, thanks so much for taking the time to learn a little bit about our company. As a matter of introduction, I'm Jim Min. I'm the CEO and the founder of a company called Clearly. And Clearly is a digital healthcare company that really aims to do earliest and most personalized identification of patients at risk of heart attacks. When we started Clearly, our goal was really to develop a care management platform for evaluation, education, implementation, staging, treatment, and tracking of heart disease. We really never intended to become an AI company, but we recognized that the best-in-class algorithms were AI-enabled, and we leveraged those to really improve our understanding of a personalized examination of patients' hearts. The Clearly digital care pathway is really a multi-step process that starts with non-invasive imaging using coronary CT angiograms, where our software now enables whole heart phenotyping of actual heart disease. If you think about it, over the last 70 years, heart doctors have actually never measured heart disease directly. Instead, we've become very good at looking at indirect either consequences of disease or surrogate markers of disease, not the disease itself. Our company focuses on heart disease directly, which is the atherosclerotic process, or the plaque that builds up within the walls of the heart arteries silently over many decades in most people, and places them at risk of heart attacks, but they don't understand that risk because they don't feel any symptoms, they don't have any abnormal tests, and so we really want to get those people early. We believe that the Clearly digital care pathway really covers the entire continuum of patients at risk, from very early stages of disease where we can prevent the disease from progressing easily, to very late stages of disease when patients may become symptomatic. As a team, we're trying to tackle the world's #1 public health epidemic, which is death due to myocardial infarction or heart attacks. And we truly believe that a personalized and standardized approach will be the most successful and overall reduce the total cost of care to the healthcare system.
Hi, I'm Jeff, co-founder of RadAI. RadAI Omni automatically generates the impressions of radiology reports, customized to each individual radiologist's language and style. This saves radiologists 1 hour per 9-hour shift, while reducing radiologist fatigue and burnout, and increasing the accuracy of reports. We integrate into all major voice recognition products in the market and work right out of the box without any on-prem servers or VMs. It's a zero-click solution with no changes to the radiologist's workflow. It generates the radiologist's exact language and style because it's pre-trained on all their historical reports and on over 160 million reports overall. It also automatically generates follow-up recommendations based on national consensus guidelines, making reports more consistent and helping make sure that patients receive appropriate follow-up. We work with over 50 radiology practices, including 8 of the 10 largest radiology practices in the US. Many of the largest practices have expanded RadAI Omni to all their radiologists. Over the past year, RadAI was awarded Best New Radiology Vendor by Aunt Minnie and named to the Digital Health 150 and AI 100 by CB Insights as one of the most promising AI companies in the world.
Hear in their own words why they should win.
I'm Jeff Chang, co-founder and CPO of RadAI. I'm an ER MSK radiologist who started really young, college at age 13, medical school at age 16, became the second youngest doctor on record in the US, and practiced for over 10 years. RadAI Omni automatically generates the impressions of radiology reports, customized to each individual radiologist's language and style. We work with over 50 radiology groups, including 8 of the 10 largest private practices in the US. We save radiologists a median of 1 hour per 9-hour shift, while reducing burnout and improving the accuracy of reports. RadAI Continuity automates follow-up care coordination for significant incidental findings. We work with health systems to ensure patients get their necessary follow-up, automating communication, tracking, exam ordering, scheduling, and closing the loop. This helps make sure that patients don't slip through the cracks, reduces health system liability, and generates new value for health systems. RadAI is growing rapidly and has tripled in revenue and customer traction over the past 9 months. This past year, we've been named as Best New Radiology Vendor by Aunt Minnie, and named to both the Digital Health 150 and the AI 100 by CB Insights as one of the most promising private AI companies in the world. What's our superpower? RadAI Omni is the only AI solution on the market that reduces radiologist burnout by directly impacting the radiologist's most tangible product, the report itself. RadAI has by far the largest dataset of radiology reports among startups at over 160 million reports, which makes the accuracy of the product difficult to match. There are no competitors for Omni. It's designed and built specifically by radiologists for radiologists and embeds seamlessly into existing workflow as a zero-click solution. A radiologist leader at one of the largest practices in the country noted, "When we deployed a smart triage solution named Best in Class, it took our radiologists about a year to get used to the product. For RadAI Omni, it took most radiologists a day." RadAI continues to improve rapidly. It's become 3 to 4 times as fast since launch. Our features continue to expand, and we respond rapidly to radiologist feedback, ensuring a highly positive customer experience.
Presenting Immunize end-to-end platform that provides granular, reproducible immunological insights at scale to help detect, diagnose, and accelerate drug development through a comprehensive understanding of the immune system. Immunize platform identifies rare cell types and decouples complex cell states to correlate immune surrogate endpoints with clinical endpoints. Following our expertly designed protocols, we start with biological samples and process them in different configurations of sample and library preparation to generate single-cell sequencing data. The generated data is then processed through a fully automated computational pipeline powered by our machine learning algorithms to harmonize, annotate, and interpret the single-cell sequencing data. Immunize, decoding the immune system to improve health.
Hear in their own words why they should win.
How do we bridge the gap between animal biology and human biology? At Immunize, we believe that the answer lies within the immune system. In the past 4 years, we've been fully mapping the human immune system by combining the power of single-cell technologies, allowing you to measure tissue at the single-cell resolution, together with big data infrastructure and data mining and machine learning. And together, we have a vertically integrated platform that allows you to do immune profiling and functional genomic to go from correlation to causation. There are 2 core pillars of the platform. The first one, AMICA, the database, standing for Annotated Multi-Omic Immune Cell Atlas, is the largest clinical genomic database for measuring the human immune system. And the second aspect is the preclinical in vitro and in vivo systems that allow us to recapitulate the human biology. How do we combine the 2? By leveraging engineering-first and computational models to mine the database coming from the clinical samples and the preclinical models. By analyzing it and applying causal inference, we can try to understand how, if, and when patients are going to respond to certain therapies by analyzing them earlier preclinically. This is a very ambitious goal, and the only way to get there is by generating more and more robust and granular data. What is special about our computational models, about our machine learning and AI? The answer is that we have a differentiated engineering-first platform. The database that I mentioned has tens of thousands of samples coming from both clinical patients in the clinic and animal models. Building the tools to integrate large datasets, harmonize the data, reduce the batch effects, even before you start applying more sophisticated data mining tools, is the key to getting more actionable insights. The future of drug discovery, drug development, and diagnostics lies in the ability to create vertically integrated platforms that will combine engineering capabilities together with experimental immunology, biology, and chemistry.
Hi everyone, I'm Dave Kurguntla, co-founder and CEO of Aleo. Aleo is empowering dialysis patients to live with peace of mind. And what that means for the over 4 million patients that live with this each and every day is that it has become a very burdensome and costly experience. Here in the US, despite being 1% of the overall Medicare population, it's almost 10% of the overall Medicare cost. And that results because of preventable complications including fluid overload, i.e. heart failure, that results in almost 2 weeks a year in ICU per patient. Aleo is an end-to-end remote patient monitoring platform. It starts off with a non-invasive that is worn by the patient. They go about living their lives without any intervention from the patient. It's picking up some raw data from their vascular access, and then it is transformed from raw data into clinically actionable data on some of the key metrics that clinicians already use to monitor those patients today. It's not just about the technology, it's about being able to address the limitations of dialysis patient management today with a product that is easy to deploy and distribute in terms of a box that is handed to the patient. It's easy to use out of the box. So leveraging our AI capabilities to transform remote patient monitoring is an amazing opportunity for Aleo to be an amazing company in the future.
Hear in their own words why they should win.
Hi everyone, I'm Dave Kurguntla, co-founder and CEO of Aleo. Aleo is empowering dialysis patients to live with peace of mind. And what that means for the over 4 million patients that live with this each and every day is that it has become a very burdensome and costly experience. To date, even though we're federally mandated to take maybe monthly blood draws, we know that can help keep patients out of the hospital. That's like only getting maybe one snapshot a decade for an entire century, as opposed to a video of the course of events to help us understand what happened, when we could intervene, and be more predictive for the next century moving ahead. Aleo is an end-to-end remote patient monitoring platform. It starts off with a non-invasive that is worn by the patient. They go about living their lives without any intervention from the patient. It's picking up some raw data from their vascular access, and then it is being able to be transformed from raw data into clinically actionable data on some of the key metrics that clinicians already use to monitor those patients today. So they've got an international set of guidelines. We're just leveraging that to be put into that video rather than just that snapshot once a month. I think it's an amazing opportunity to have the momentum behind us now, right? So these expanding partnerships clinically, commercially, a little bit more of that awareness. I think what we want to be a part of is what's the next step? KidneyX has done a great job of stimulating innovation. I think now making sure that clinicians understand what innovation is available to them, ensuring that that reimbursement world is available to all the other innovative products that are coming out there, that CMS is aware that there is so much innovation coming in this space. I think those two key things is really going to drive the adoption that will enable better patient outcomes and also reduce the workload for physicians and providers, and also reduce costs for the payer. So really aligning the patient, the physician, the provider, and the payer is going to have the best outcome for everyone in service of patients who want to be met where they are.
Hey everyone, I'm Aniket Singh, founder and CEO of Neurogly Therapeutics. When I started Neurogly a year and a half ago, it really started with a dream to reimagine the entire care for patients living with neurological conditions and improve clinical outcomes, not only for just the patients, but also for the family members and their loved ones. We are a technology-first care delivery company offering virtual neurology specialty care. At Neurogly, we have built a platform which really consists of three important components. First, a suite of digital monitoring tools to capture the right data from the right sensors, both actively and passively. Second, a library of cognitive intervention tools like cognitive training games, education, reminiscence, etc., etc. And third, we have efficacy assessment tools to really understand how these cognitive interventions are actually impacting the patient's cognition and use our adaptive engine to personalize these interventions, therefore moving the needle from one-size-fits-all therapy to finding the best therapeutic fit for that patient. Today, Neurogly offers a scalable and evidence-based at-home cognitive care program by leveraging our platform along with our expert clinical care team. We have great collaborations with leading hospital systems like Mayo Clinic, and we have also launched Neurogly Connect with Nuance Health in New York and Connecticut. Everyone at Neurogly are on a mission to empower people living with neurological conditions and their families to really lead a productive and meaningful lives by truly revolutionizing personalized healthcare and patient experience.
XCures is a technology platform that identifies and ranks the most promising treatment options for advanced cancer patients. Using the combined power of AI, predictive modeling, and natural language processing, the XCures platform transforms a patient's complex, unstructured medical records into a structured personal health record that can be actively cross-referenced against a vast library of oncology data. The result is a match for each patient, with potential treatment options, often novel or off-label, based on insights from leading experts and predicted outcomes. This empowers patients and their oncologists to make the most informed and effective treatment decisions. Each year, there are more than 1.7 million new cancer diagnoses, hundreds of thousands of published articles about cancer treatment, over 1,000 new drugs in development, and tens of thousands of active clinical trials. With only 13,000 oncologists and 24 hours in a day, advanced computing power is a crucial tool in the fight against cancer.
Hear in their own words why they should win.
XCures is a direct patient and oncologist clinical decision support platform. We help patients and their doctors understand what are the best possible treatment options for them to try to pursue. We do this by doing two things. Number one, we aggregate, organize, and structure patients' medical records from anywhere in the United States, from any institution, into a highly structured cancer journey. That enables us to understand where the patient is in their journey. The second thing that we do is we match that set of patient features using our AI-powered recommender engine technology to a large catalog of all of the things that are being considered clinically for treatment of cancer. This includes standard of care, off-label options, clinical trials, expanded access, compassionate use programs, and right to try. The objective here is to try to solve the problem that every patient and or their loved ones face when they find out about a cancer diagnosis or are looking for a new treatment option and go home and try to search for it on the web. That information is too difficult and too unstructured to use. In the process of providing those services, XCures acquires the data not only for the decisions that the patient makes, but for their long-term outcomes. We use that outcomes data to do two things. Number one, we're able to continuously improve our process and enable better decision-making. Basically help patients and their doctors understand, what did a patient like this do? And did it work or did it not work? Very valuable information. The other thing that we're able to do is to support a new form of research. This is completely decentralized research available for any patient and doctor to participate in anywhere in the US. To date, we have used that in many programs to enable our partners to understand, are their drugs, devices, algorithms working? And if so, what is the impact that they have on patient outcomes? And also to understand other such topics, such as quality of life or other patient measures as related to cancer care.
I'm Suchi Saria. I'm the founder and CEO of Bayesian Health. I also hold an endowed professorship at Johns Hopkins in engineering, public health, and medicine. I've worked in the field of machine learning for now almost 20 years. Bayesian's built an intelligent care augmentation platform that empowers clinicians with real-time clinical insights to catch patients with declining trajectories earlier and treat them in a timely way. We work in areas like sepsis, deterioration, pressure ulcers, transitions of care, palliative care, all areas impacting margin, revenue, outcomes, and quality. Why did we succeed when others have failed? First, people have historically used rigid, logical frameworks or monolithic models that don't really adapt to the complexity of healthcare. We've built adaptive AI platform that tunes to diverse populations over time, to diverse practices, workflows, and settings. Two, we built it so that it's very, very easy to use. And three, we've created integration with Cerner and Epic, but also various health system processes to make it very easy to increase adoption and engagement. In 3 groundbreaking studies featured on the cover of Nature Medicine last week, we showed 20% reductions from the use of our tools in mortality. This is the first time ever AI has been shown to save lives. Additionally, we showed nearly 90% adoption by providers. Typical tools garner 10 to 12% provider adoption. These studies were also groundbreaking in a number of other ways. It was deployed over a 3-year period, 5 sites, nearly 750,000 population, and 4,000 plus clinicians participating. This is only a few of the 26 plus peer-reviewed publications and high-profile venues backing our work. And I think it's our intense focus on hard evidence, validating adoption and outcomes in real-world settings, as opposed to hype, that is our superpower and what's driving our success.
Hear in their own words why they should win.
La enfermedad cardiovascular es la primera causa de muerte en el mundo. Mata a más de 17 millones de personas cada año. Para intentar luchar contra este problema, los médicos dedicamos más de 1 millón de horas al día analizando electrocardiogramas para intentar diagnosticar estas enfermedades o incluso predecirlas. Esto es una tarea repetitiva, tediosa, en la que los médicos aportamos escaso valor. Soy cardiólogo y durante años he trabajado en centros de investigación y hospitales viendo este proceso disfuncional. En Aidoven hemos creado un software de inteligencia artificial que ayuda a automatizar estos procesos en los que los médicos aportamos escaso valor, para ser más eficientes y más rápidos en el diagnóstico. Nuestro software ha aprendido cardiología de más de 49.000 pacientes y 1.200.000 horas de registros de corazones reales. Estamos trabajando con 18 de las mejores universidades y centros de investigación del mundo, como la Sorbona, Oxford o el CENIC. Y confían en nosotros empresas líderes del sector, tanto fabricantes de dispositivos médicos como grandes compañías farmacéuticas. Creo que las startups tienen la capacidad real de cambiar el mundo y no tengo ninguna duda de que softwares como el nuestro de inteligencia artificial van a optimizar esos procesos que hoy no funcionan bien. Para Aidoven, hoy es un día importante. El objetivo ahora es seguir mejorando nuestro producto, llevar nuestra tecnología al siguiente nivel con el mejor equipo y con una ambición global, para ayudar a miles de médicos y millones de personas en todo el mundo.
Hi, my name is Sanjay Basu. I'm a primary care physician and one of the co-founders of Waymark, a public benefit organization that seeks to improve access and quality of care for people receiving Medicaid. We deploy and train teams of community health workers, therapists, and pharmacists, along with telemedicine solutions and psychiatry solutions, to help patients who are receiving Medicaid and their primary care doctors. The interventions that we deploy have been found by independent scientists to return about $2.50 on average for every dollar invested. How does this work? One of our key technology platforms is a set of machine learning algorithms that help us identify which people to intervene on, with which intervention, and at what time. For example, let's take people with diabetes. About 1 in 10 Americans has diabetes, and there are many different medications to choose from. Some of the medications can be revolutionary. On the other hand, the same medication for a slightly different person can result in a severe adverse event, one of the major causes of emergency department visits in the United States. However, there have been many randomized trials and meta-analyses or network meta-analyses, which allow us to compare amongst different drugs. And when we train our machine learning algorithms on these meta-analyses, we're able to see which complex constellation of features allows one patient to benefit from a drug and their neighbor to perhaps have a severe adverse event. We've developed specific algorithms and tools so that our staff can do personalized benefit and risk calculations and incorporate people's individual preferences, such as whether they'd like to avoid an injectable medication. We populate these kinds of interventions in our own patient management software that allows us to rank which patients to outreach with which intervention and through which modalities. And critically, it allows our staff to provide feedback. For example, our staff notice things that data scientists often don't, such as that people who are taking insulin and are food insecure tend to get their hypoglycemia visits towards the end of the month for diabetes. Why is that? People who are food insecure often get food stamp benefits towards the beginning of the month and are running out of food towards the end. And if they're taking insulin, can get dangerously low blood sugars. We were able to target a food voucher intervention towards the end of the month, which, if scaled nationally, could avert about 5,000 emergency department visits and hospitalizations every year. This type of intervention to address health equity and improve health disparities is the kind of thing that motivates us at Waymark.
Patients with ARDS, Genie's next-gen substrate-selective and specific immunomodulatory P38 alpha kinase drug has multiple mechanisms of action. Genie's drug is highly permeable and enters the lungs easily. Once there, Genie's drug decreases inflammatory cytokines and decreases activation of the neutrophils. It stabilizes and repairs the endothelium and prevents fluids from entering into the lungs. Genie's drug may also have a direct antiviral effect for SARS-CoV-2. P38 kinase inhibitors bring back the loss of ACE2 activity and prevent thrombosis and clotting. Therefore, Genie's next-gen P38 immunomodulator has multiple mechanisms of action and has the potential to improve ARDS in patients.
Hear in their own words why they should win.
Genie Life Sciences is a clinical stage, phase 2 ready company. We are a multi-target AI platform accelerating therapies for rare and inflammatory diseases. Genie is led by Dr. Ritu Lal, an R&D leader with over 20 years of experience and 3 approvals under her belt. We also have a stellar team of experienced leaders in machine learning platform technologies, physics, research, and clinical development, and are fortunate to have excellent scientific advisors helping us. Genie has developed a differentiated machine learning platform that uses a platform in a mechanism approach. We integrate machine intelligence, computational physics, and chemical biology to supercharge our end-to-end development process from drug discovery to clinical trials, delivering unprecedented cost and time efficiencies. The need for our innovations is enormous. Out of 7,000 known rare diseases, 95% have no therapeutic treatment, affecting nearly 1 in 10 Americans today. With our platform, we are recharging the traditional drug development model by enabling a greater probability of success and bringing therapies faster to patients with huge unmet medical needs. Here are some key differentiators of our ML platform. 1. High-quality in-house generated and in-house curated proprietary data, which connects the genes, proteins, pathways, diseases, and our compounds. We have solved the data scarcity problem, which inspires greater confidence in our decisions. 2. We integrate wet lab experiments, bioinformatics, and computational physics to improve our decision-making model across modalities. 3. End-to-end AI, from drug discovery to lead optimization to clinical candidate selection to clinical studies. We integrate the entire drug development process, creating powerful feedback loops.
So the Smith Heart Institute is currently the #3 cardiovascular program in the country. And through our work focused on value-based care, providing the highest quality care at the most affordable cost to our patients. We've been able to climb from the number 10 spot a few years ago all the way up to number 3. And our goal is to continue to rise through the ranks so that we can provide the number 1 level cardiovascular care to the patients that come through our doors.
Biome's proprietary solutions have helped hundreds of industry-leading cardiovascular teams, hospitals, and health systems improve quality and save millions in cost.
On a daily basis, we're engaging with Biome to be able to unearth and uncover the opportunities to be able to both increase quality and decrease cost. At the core of the mission of the Heart Institute is to be able to provide that high-value care, and Biome is instrumental in being able to identify how we're able to accomplish that on a day-to-day basis. When we searched for organizations, we wanted a group that we'd be able to talk to like we would talk to peers. And Biome's focus on cardiovascular medicine allows their analysts to be able to understand what it is that we as clinicians are looking for and help us really hone in on what the clinical question is that needs to be answered.
Biome leverages their clients' data with deep expertise, so clinicians can focus on the performance opportunities that deliver the best care to the most patients at the lowest cost.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.